This is Tar Heel Talk, an in-depth look at the issues and people making news in North Carolina. Here's your host, Sonia Williams.
20 million adults in the U.S. suffer from a sleep disorder known as sleep apnea, and 4 out of 5 Americans diagnosed don't even know they have it. March is National Sleep Awareness Month, and here to tell us more about sleep disorders and how to get screened for them is Lisa Firestein with Active Healthcare. Lisa, welcome to Tar Heel Talk.
Thank you.
Now, sleep apnea, I understand, is a fairly common sleep disorder. What exactly is it?
Well, sleep apnea is characterized by pauses in breathing while you're sleeping. And people can have this happen hundreds of times a night. And so they wake up feeling really tired and lousy.
Is that the most common symptom then, is just being extremely tired and just feeling bad?
That is one of the most common symptoms, is what we call excessive daytime sleepiness. But some of the other common symptoms are snoring. And I'm here to tell you that it's not just a man's problem.
Okay.
Women also snore, they just don't like to tell anyone. And actually 6 out of 10 adults have admitted to snoring. So snoring, excessive daytime sleepiness, lack of gasping for air, and pauses in breathing, which is actually noted by a concerned bed partner. Some of the less common symptoms but can be associated with sleep apnea are morning headaches, frequency of nighttime urination, just a reflux, and a lack of energy and disinterest in sex.
Okay, so there are a number of symptoms that kind of run the gamut there. What are some of the treatment options? Well, before we even talk about treatment, I understand that it's often difficult to even diagnose sleep apnea. Why is that?
Well, it's really very easy to diagnose sleep apnea. What's the difficult part is getting somebody first to recognize that they may have a problem and go seek help. And so many times it is the concerned bed partner that notices a lot of those symptoms and encourages their mate to seek help. And so I believe a lot of people don't associate the symptoms of feeling tired and lousy with possibly their nighttime sleep habits. And so they just go about their life, take energy drinks and drink caffeine and don't get the help they need, where sleep apnea is a real disease. With a diagnosis, there's effective treatment.
Okay, we're going to talk about some of those treatment options in just a minute, but I can imagine if you do live alone or if you're sleeping in bed alone, it can be difficult for you to realize that you are doing these things. What type of screening mechanisms are available to make that diagnosis?
Well, some of the screening mechanisms out there are risk assessments. And there's a series of questions that one is asked. And when they answer those screening assessments, they can see if they're at risk. So that's a lot of the screening tools. And then a thorough history by a physician, where a physician can ask about a lot of nighttime sleeping habits and waking habits, and then do a full history and physical and really looking at the anatomy of the upper airway.
Okay. When does a sleep study become necessary?
When a patient does screen positively for a high risk of sleep apnea, then the physician would want to send a patient for a sleep study.
Okay. Let's talk a little bit about treatment options. You've brought along something to show kind of one of the treatment options that are available. Let's talk a little bit about what you have here.
Well, I would say that the gold standard for treatment of sleep apnea is a PAP device, and a PAP device stands for positive airway pressure. And the CPAP that I brought with me here is a machine that gently and quietly pushes air through a tube, through a mask that's on somebody's face, and it keeps the airway open.
Okay, and this is something that a patient would sleep in overnight?
They would sleep in just when they go to sleep and take it off when they wake up. And what we do at Active Healthcare is work with the patient to get them used to using it. There's lots of different choices in mask, and so we spend a lot of time in finding that right mask, and then we help them by motivating them, educating them, and follow up with them on a consistent basis, because it is a lifestyle change.
Okay.
It is not something that somebody naturally does when they go to sleep, so it takes a lot of help and work.
So once you have one of these devices, is it pretty much something that you're going to need to sleep with every night for the rest of your life?
Yes.
Okay.
Sleep apnea is a lifetime condition unless there is a change in your situation, and typically the change might be a very large weight loss.
Okay.
And doesn't necessarily mean the sleep apnea goes away. It just means that maybe you need to be checked again to see if your treatment levels are correct.
Okay. Now, I guess that leads to another question. Who is most at risk for getting sleep apnea? Are there any particular risk groups?
Yes, absolutely. So 2% of women and 4% of men have sleep apnea. And so we would say that men are first. They are more at risk for sleep apnea. Folks that are obese are at risk for having sleep apnea. And those that have a diagnosis of high blood pressure and a neck size that for a man is greater than 17 inches and a woman greater than 16 inches.
Okay. Now, the whole issue of sleep has been getting a lot of attention lately. We even see commercials now where you have an athlete who does amazing feats on the field who credits those to getting a good night's sleep. Is it that just sleep awareness is heightened now, or is it that more Americans just aren't sleeping well?
Well, I believe it's the more Americans aren't sleeping well. The National Sleep Foundation has shown that up to 70 million Americans have some type of sleep problem, with the majority of those sleep problems being insomnia, sleep apnea, narcolepsy, and restless leg syndrome.
Let's talk a little bit about some of those other sleep disorders, because as you're saying, it's affecting a lot of people across the country.
It is. And so insomnia is really when somebody either has difficulty getting to sleep or they have difficulty maintaining sleep. Very common disorder, as we know from a lot of the advertisements, the pharmaceutical advertisements we see on the news. And then restless leg syndrome is when a person actually has jerking motions while they sleep of their legs. They don't know they have it, but it constantly wakes them up. Many arousals during sleeping, and so they don't get into that deep stages of sleep. And narcolepsy is when somebody falls asleep at an inappropriate time, at the wrong time. They just fall asleep. And so, and we've already talked about sleep apnea.
Mm-hmm. And all of these disorders are treatable?
All of them have different types of treatment.
Mm-hmm.
Yes.
Okay, we're going to take a break. We'll talk more about that in just a minute.
Okay.
All right. Coming up, we'll talk more about sleep disorders and how to get help for them. Tar Heel Talk will continue after these messages.